My name is Dr. Broadworth, and I am a physical therapist and a board-certified orthopedic clinical specialist. I'm going to go over the exercises that you need to do if you are about to undergo a total knee replacement. A total knee replacement surgery can be a pretty intense surgery with a pretty intense rehab. And research shows that if you go through prehab and do the correct exercises and rehabilitation necessary prior to the surgery, that you will have better outcomes. So that is what this video is for, is to show you some general exercises to help you have the best outcomes possible following your surgery. Now, that being said, everyone is different, and I strongly recommend that if you are having a total knee replacement surgery, that you go see a physical therapist to have a customized prehab to specifically meet your needs. Now, some of the things that are very important heading into the surgery is that you regain as much range of motion as you can in your knee prior to the surgery. So we're really looking for anywhere from ideally from 0 to 120 degrees of so 0 degrees of extension or 120 degrees of flexion in the surgical knee or greater in terms of that flexion. So getting that knee as straight as possible, that's 0 degrees if it's totally straight, and then 120 degrees of knee bend or flexion if you can at the minimum. That will help you regain that range of motion following the surgery. After that, you really also want to focus on strengthening the muscles not only around the knee, but also around the hips as well, and your core stability. And if you're lacking any strength at the ankle, that's necessary too. I find that a lot of times people dealing with knee problems also have quite a bit of hip weakness and poor core weakness. So that's what these exercises are going to focus on. So let's get right into it. We're going to focus on the range of motion exercises first. So the first exercise, I'm going to lay right down here, and I'm going to use my right leg for an example. First exercise is called the quad set. Now the quad set is going to help you regain that knee extension range of motion, or the ability to straighten your knee. And we're really going to also focus on activating these quads with this exercise. So what you want to do is you want to point your toes or dorsiflex your ankle, so pointing your ankle towards my head. That's going to allow me to engage my quads a little more. And then I'm going to tighten my quad muscles, pushing my knee down into the table, straightening that knee as much as I can. I'm going to hold for 5 seconds, so 5, 4, 3, 2, 1, and then relax. So just like that, I'm pointing the toes and the ankle towards my head. I'm tightening the quad, straightening the knee, pushing it down into the table, holding for 5, 4, 3, 2, 1, and relax. And I'm going to do about 10 reps of those, and typically about 3 sets. Now, if you have difficulty with that exercise, you can also roll up a towel, put that under your knee for to help if you're having more discomfort, or if you're having a tough time engaging those quads and trying to figure that out. Putting something under your knee can help to improve your proprioception, or your body's ability to know where it is in space, so that you can better engage those quad muscles and make that work. The next exercise we're going to do is a knee extension with some overpressure. So I've got my foot on a chair and my knee is straight, and I'm going to do that same quad set. However, this time I'm going to use my own hands to help give a little overpressure and push that knee down. So I'm tightening the quad, using my hands to push down, hold for 5 seconds, and relax. And you can kind of go into a little knee bend when you relax, and then we're going to go into it again, holding for 5 seconds, 4, 3, 2, 1, doing that quad set while pushing down with my hands, and relax. So that's going to help with that little bit of overpressure, really help to stretch the tissues a little more, some of that connective tissue, so that way you're getting a good stretch and helping to get, again, that knee extension range of motion. Now the next exercise is called a heel slide. So I'm using a belt here, and I've got shoes on, but you can put either use a sock under your foot or something that slides well. okay? And you can use either a towel or a pillowcase and put that around your foot to assist, but I'm gonna lay back like this. You could also do it sitting up, but I find it's a little easier to do laying down. And what I'm gonna do is I'm gonna bend my knee, sliding my heel along the table towards my butt. And then when I get to the end where I don't feel like I can go much further, I'm gonna pull right here on the straps and to give a little bit more overpressure. And again, we're gonna hold for 5 seconds, feel a good stretch, and then you're gonna straighten that knee out. And then we're gonna do it again. So again, these are called heel slides. I'm sliding it along the table towards my butt. Once I get to the end, I'm pulling on these straps, hold for 5 seconds, and relax. So those are some exercises to really help regain that range of motion. Next, we're gonna go into some of those exercises to help strengthen those hips like I had talked about before. So the first exercise that we're gonna do is called a straight leg raise. So I'm gonna do it on this right leg. So my left knee's bent, my right leg's straight. I'm gonna do that quad set we did at the beginning, okay, to straighten that knee. And now I wanna hold that knee as straight as I can in that quad set position. I'm gonna lift my leg up so that my right leg and thigh is now parallel with my left. I don't need to go any higher than that. And then I'm gonna slowly lower, keeping that knee straight the whole time. And you don't have to hold, it's just a pause at the top and then down, nice and controlled movement. And that's really gonna help strengthen up those hip flexors in the quads. The next exercise, so after the straight leg raise, we got a side leg raise. So I'm gonna lay on my side. I got my bottom knee bent. My top leg is straight, my knee's straight, my toes are pointed forward. I wanna make sure I'm totally on my side and that my top leg isn't my hip's not in a flex position. So you wanna keep that leg behind the heel of the bottom leg that's bent. And if you need to, you could even do this against a wall. So have your back against a wall and you can slide the leg up and down the wall. That's one way to help cue your body. But if you don't have a wall necessarily, or you don't want to mark it up, just make sure you're on your side. I like to put my hand on my hip so that way I'm not rolling through my pelvis. That's how a lot of people cheat, is they'll lift up like this and they'll rotate up kind of like that, and they're going to utilize some of their hip flexors. We want to stay on the side. Got my hand on my hip to stabilize, and I'm going to keep my toes pointed at the wall, and I'm going to lift up about 12 to 15 inches and then down, keeping that leg, again, that hip a little bit an extension behind the heel of my bottom leg. So just pause and then down. And with these exercises, both the straight leg raise and the side leg raise, I recommend doing it on both sides. So that way you get a little carryover. You do get a little carryover from one side to the other with the nervous system and with strengthening. So the next exercise we're going to do, so that was the side leg raise. The next exercise is called a bridge, or glute bridge, some people call it. What you want to do, I got both knees bent. I'm going to tighten my buttocks. So I'm going to tighten up. I'm going to then lift my hips into the air. You're going to feel this in the hamstrings and your butt. You're going to hold for 5 seconds, 4, 3, 2, 1, and then slowly lower. So again, tighten the butt, lift up, hold for 5 seconds, 4, 3, 2, 1, and lower. And this is really going to work on strengthening your glutes and your hamstrings. Again, typically with all these exercises, I'm recommending about 30 reps total. If you need to break into 3 sets of 10, making sure you have good form and good control the whole time. The next exercise is called the clam shell. So with the clam shell, I'm laying on my side again. Again, if you need to do this against a wall, you can. And I'm going to stabilize through the pelvis here. I'm not cheating. This is a big one. I see how people do this is they'll lift up like this and they cheat and roll back to get that top knee up. So you want to stay on your side, and you're going to keep your heels together and lift your top knee away from your bottom knee, just like so. So this is called a clam shell, and you just pause and down. Again, I'm not rotating through my pelvis or my low back. We're doing, again, both sides, typically 30 reps, 3 sets of 10. And if you find that's easy, you can always increase the reps or add some resistance. Next, we have a plank. So core stability is extremely important. So with the plank, I've got my elbows under my shoulders, my feet are together. I'm gonna lift my butt up, so then I have a nice neutral spine right now. Okay, I don't have my butt hiked way up, I'm arching my back. You want a nice neutral spine. And you're gonna hold. I typically start my patients at holding for 20 to 30 seconds. And if you find that's easy and you wanna go to a minute, you can do that. If you find that that's too hard and you wanna modify it and go either onto your knees, like so, or you could go into a push-up position or a high plank position where your arms are straight and you're holding like this. You could do that as well. Those are some modifications for the plank. So those are the exercises that I recommend to start with for your prehab. Again, I recommend that if you are undergoing a total knee surgery, that you have some appointments with a physical therapist prior to the surgery to have a plan that is customized to your needs. If you found this video beneficial, please like it, put a comment in the comments below, and you can also ask any questions with any comments below. Don't hesitate to reach out and message me as well. Again, I hope you found this very beneficial. Good luck with your total knee replacement surgery, and I hope you all have very successful outcomes. So thanks so much for watching.